All right, so our project was macular degeneration. So what is macular degeneration? Macular degeneration essentially causes you to lose your central vision, although you will still have your peripheral vision. This loss of central vision is due to the fact that the central retina is deteriorating, as you can kind of see on this picture below, where the image on the right, there's no real central vision to it. And on the left is what normal vision would look like. So there's two types of macular degeneration. The first type is wet macular degeneration, which is less common, but it is more serious. So when new and abnormal blood vessels start to grow under the retina, these vessels have the ability to leak fluids that can scar the macula, leading you to lose your vision faster. Many people do not even realize that they have this condition until they notice that their vision has started to become more blurry than before. The other type of macular degeneration is dry macular degeneration. This is more prevalent it's more prevalent as about 80% of people with macular degeneration have it. This occurs when the central parts of the macula thins as you age. As the macula thins, tiny clumps of protein called drusen will grow and shield part of the visual image from reaching the macula. As a result, you will lose your central vision, albeit more slowly. As you can see on this image here, it's showing the difference between dry and wet macular degeneration with a normal healthy macula in the middle. You can see with the dry macular degeneration, there's no bleeding present. However, hence the name wet macular degeneration, there is bleeding present. So who is at risk for macular degeneration? You are more likely to develop macular degeneration if you fall into any of these categories listed below. If you engage in eating a diet that contains foods that are higher in saturated fats, such as red or processed meat and butter, if you are overweight or obese, if you smoke cigarettes, are over the age of 50, have high blood pressure or hypertension, or you have a family history of macular degeneration.
All right, and I'm going to be talking about the current treatments for macular degeneration. So, regarding dry macular degeneration, there's no medication therapy, but instead it's more focused on nutrition therapy and healthy diets. But for wet macular degeneration, there's a few different things that are more medication therapy and surgery related. So, we have laser photocoagulation, photodynamic therapy, and antivascular endothelial growth factor therapy, or VEGF therapy. So for dry macular degeneration treatments, you're going to have supplements including a combination of antioxidants, carotenoids, and omega-3 fatty acids, having diets filled with antioxidants in order to support the macula. And if there's a family history of macular degeneration, then it's a good idea to keep these levels pretty high. So regarding the supplements and the foods for dry macular degeneration, there was a clinical trial conducted called the Age-Related Eye Disease Studies, and these focused on lowering the risk of age-related macular degeneration through supplements. So following the combination of supplements below, the results showed a 25% decrease of AMD or age-related macular degeneration. So you have 6 to 10 milligrams of lutein, which is transported to the macula and has an antioxidant action. Then you have zeaxanthin, 2 milligrams, which may increase the concentration of macular pigment, which leads to stronger eyes. You have 1,000 to 2,000 international units of vitamin D3, 400 international units of vitamin E, 1,000 milligrams if you're not eating fish of omega-3 fatty acids, 500 milligrams of vitamin C, 20 to 80 milligrams of zinc. And beta carotene is typically helpful, but it's already found in most foods, so supplements not necessary. Regarding anti-VEGF therapy, there's two specific drugs that are the main therapy currently. Bevacizumab Bevacizumab or Avastin, and then there's ranibizumab or Lucentis. And these are both monoclonal antibody antigen binding fragments, and they're intravitreal injections that are in the eye, and they selectively bind VEGF as an inhibitor to block the formation of new blood vessels. Regarding laser photocoagulation, it uses the heat from a laser to focus on blood vessels in the eye. There's two different types, focal and scatter. Focal is used to seal specific vessels near the macula, and these are more of a few lasers, but they're targeted laser burns. And scatter is used to slow the growth of new blood vessels over a wider range of the retina. So there's lots of laser burns to stop the growth. And these stabilize the vision and prevent future loss, and they lead to photodynamic therapy. So photodynamic therapy is known as cold laser, and it's only a treatment for wet AMD. So abnormal blood vessels in the eye are targeted, as you can see in number 1 over here. And then there's a medication called verteporfin or Visudyne, and it's injected in the bloodstream of a patient. The drug circulates around the body and slowly flows into the eye. And then the cold laser is turned on here in number 3, and it activates the drug in the eye only in the abnormal blood vessels. So when it's activated in the abnormal blood vessels, it causes them to clot and essentially seal them from the eye, which is known as like the destruction of the abnormal blood vessels here in number 4. And you may need multiple treatments, and it's typically only done if anti-VEGF drugs are not successful.
All right, so next I'm going to be touching on some of the future treatments. So as Rohan was going over, sort of a lot of the current treatments we currently have result in lower efficacy than we see during the clinical trials. A lot of times this is due to patients being non-compliant and not adherent to these injections that they need to get. And a lot of times the patients miss follow-up appointments or visits for the injections. So the aim for these future treatments is to sort of decrease this treatment burden of these frequent injections. And they're doing so by lowering the number of injections. So some of the medications that I'm going to be discussing are more longer acting, and that includes Fericimab, Abyssibar, and Combercept. So the first one is Abyssibar. This is a long-acting anti-vascular endothelial growth factor design and chirin repeat protein. It's a newer type of drug, and it's sort of different from those antibody-based treatments that we currently have available. It's considered to have a high specificity as well as affinity to inhibit all isoforms of the VEGF-A. And this is smaller than antibodies, which may allow more selective targeting as well as higher affinity. And it also is administered at lower concentrations, which helps with its stability. And then the intraocular effect of this can last up for 13 days. So it's less frequent injections as compared to the current treatment, including ranibizumab, which we discussed prior, and that only lasts for 7 days. Fericimab is another one. This is a bispecific humanized monoclonal antibody. Bispecific meaning that it can recognize 2 different antigens. And this is both the angiopoietin 2 as well as the VEGF-A antigens. And this helps with reducing inflammation and enhancing the vessel stabilization as well as reducing permeability and leakings. And this was actually approved by the FDA on January 28th of 2022. And then finally, we have Combercept. This is a recombinant fusion protein, and it actually binds to all the isoforms of VEGF-A as well as B, and then placenta-derived growth factor. This medication was approved for treatment of age-related macular degeneration in China in 2013, and they have been using it there since. The dosing regime of this is 3 initial injections followed by an injection every 3 months, and this has been shown to be efficacious in a randomized phase 3 study. So if you haven't noticed, a lot of the common themes with these future treatments is that it sort of focuses on decreasing the number of appointments for the injections to help with patient adherence.